Hello guys! Ayan, mag-share lang ako tungkol sa aking sakit na carcinoma in situ. Para yung mga kababaihan aware din sa ganong sakit. Nag-start yung aking sakit nung ako yung nag-Menopouse. Naramdaman ko na lang na sumakit yung dede ko. Tapos siguro 3 days yun sumakit yung dede ko. Kaya nabahala na ako na nagpatingin ako sa doktor. Tapos ayun nga, chinekap ako. Ayun, naoperahan ako ng maliit lang na tinanggal na bukol sa palad. Bumalik din yung bukol daw. Kaya ngayon, mag-uulit ako ng surgery. Operahan ako ng lumpectomy. After na operahan, irradiation daw ako. Kaya sana wag na sanang bumalik at saka papalitan yung aking gamot na maintenance. Kaya nag-iipon ako ngayon ng pang-opera na 250 para sa aking operasyon. Sana makahingi akong tulong sa gobyerno ng medical assistance. Naagapan ko siya na hindi maging cancer. Kailangan daw pala parati ka nagpapa-pap smear para makita doon kung merong kang hormonal imbalance para magamot ka agad. Ganun daw talaga pag nag-menopause ang isang babae, doon yun lumalabas kung merong kang sakit na lalabas, doon mo malalaman. Kaya sabi niya kailangan nagpapa-check up lalo pagdating ng mag-menopause ka na. Kaya nga sabi ng doktor, at age mo ng 25, kailangan mag-vitamins ka na at kumain na ng magagandang pagkain para maging malusog yung katawan. Ang kabutihan nga lang daw, wala pang stage yung sakit ko. Kaya siniswerte pa raw ako. Kaya sana itong second na opera ko, sana wag na sanang bumalik. Tuluyan na siyang mawala. Kasi nung inoperahan ako, maliit lang kasi ang kinuha. Nung una hindi ko natanggap eh. Isang buwan yata akong parating umiiyak. Maswerte raw ako kasi wala pang stage. Kanya lang, yun nga, alaga sa monitor para hindi magkamerong stage. Kaya hindi magkamerong stage, alaga na lang sa monitor. Maswertihan nga lang, parating may maintenance, nasusuportahan naman ng maintenance. Kaya hindi mo makakalain meron akong sakit. Tingnan mo, hindi mo makakalain meron akong sakit na tinatago. Yun nga, tuloy nga lang yung buhay. Para sa mga mahal sa buhay. Yung malunggay, mula nang uminom ako, nawala yung sakit-sakit ng yung pagkikirot-kirot ng dede ko. Palagay ko, yung malunggay, maganda talaga sa kaya malalaman ko, pag mammogram ko kung anong naging resulta sa pag-inom ko ng 3 buwan. Bali, 4 na buwan. Sa August kasi ako operahan. Kasi bago ako operahan, saka mag-laboratory. Doon ko malalaman ko anong resulta ng malunggay. Sana maghimala ang malunggay na sana maganda yung resulta. Wala na yung suspicious na nakikita nila. At sana wala na yung birads 4, 5, 6, 7, ganon, mga nakikitaan nila sa akin. Sana mawala yun sa tulong ng malunggay. Mag-maintenance na lang sana ako ng gamot, huwag na sana maoperahan pa. Kasi alam nyo, yung operasyon ko, hindi basta-basta operasyon. Kailangan tubuhin daw ako. Kailangan ng anesthesiology, kasi patutulugin ako. Kasi nung unang inoperahan ako, gising ako. Habang inooperahan ako, kinakausap ako ng doktor. Kung okay daw ako, pinapalakas yung loob ko. Ni isang sakit wala akong naramdaman. Kaya kampante ako nung unang inoperahan ako na akala ko na tuluyan ng mawawala. Kaya ngayon, pangalawang opera ko, medyo mahirap kasi lalagyan ako ng tubo. Kaya sana tulungan niyo po ako magdasal para sa success na operasyon ko. Marami pong salamat. Sana po, huwag niyong kalimutan mag-subscribe and like and click na rin ang notification bell para updated kayo sa aking video na about carcinoma in situ. Yan ang content ko ngayon sa mga tungkol sa health para sa ating kababaihan, para aware yung mga kababaihan sa ating kalusugan, lalo pa sa mga nagme-menopause. Sa mga nagme-menopause na kababaihan, tulad ko, kaya bibigyan ko kayo ng tips. Yan. Bye-bye! See you next vlog!
Want to learn about DCIS, a precancerous condition of the breast? We will teach you all about it. DCIS, Ductal Carcinoma in Situ, is considered a type of breast cancer, a stage 0 breast cancer versus 1, 2, 3, or 4. But what does all this mean? The way to think about it is that DCIS is more of a precancerous condition of the breast. An area of abnormal breast cells that are changing and evolving towards becoming more and more abnormal, towards becoming an invasive breast cancer if left untreated. It accounts for about 20% of all breast cancers, and you can learn about invasive breast cancer, the other 80%, at our video lesson on invasive breast cancer at the Breast Cancer School for Patients. The threat to your life is small from DCIS if well treated. Unfortunately, the treatment for DCIS is very similar to invasive breast cancer. It involves surgery, possibly radiation therapy, possibly hormonal therapy. So there's a lot of confusion about the threat of DCIS and the treatment when compared to invasive breast cancer. In this lesson, I'm going to teach you exactly what DCIS is. I'm going to go over your surgical options for treating DCIS. And I'm also going to go over the role that radiation therapy plays and hormonal therapy plays for DCIS. I'm going to teach you the link between DCIS and the BRCA mutation, the breast cancer gene, and how you may qualify for genetic testing if you have DCIS. So what is DCIS? Ductal carcinoma in situ? Well, remember, precancerous breast cells, not normal cells, cells that are changing and not in a good way, but have not yet become invasive breast cancer where they have the ability to leave the tumor, go to other parts of the body, your brain, your bone, your liver, grow there and threaten your life. That's invasive breast cancer. DCIS in situ means the cells just don't have that ability yet. And the way to think about it, it's more of a precancerous condition. Another way to think about it is that when you have DCIS, and you're found to have that you're actually catching something early. You're catching it early enough before it's a threat to you and removing it so you lessen your chance of developing a breast cancer, a threatening breast cancer, an invasive breast cancer in the future. So in some ways it's a good thing, but on the other hand, we have to treat it. So let me give you a couple of facts about DCIS. If left untreated or poorly treated, then there's a pretty high chance of that area in the breast, the abnormal cells of DCIS, evolving to become an invasive breast cancer. Mammograms typically, not always, pick up DCIS as calcifications on a screening mammogram. So we see little white dots on a mammogram that are abnormal white dots. We biopsy them, look at it on a microscope, find DCIS, work it up, and then treat it. So it's one of the benefits of getting mammograms is that we can identify this area, these precancerous areas, before we can feel a lump or a bump in the breast. DCIS, whether you've had it years ago or you just were diagnosed with DCIS, for reasons we can't really explain in parts, a slightly increased risk of developing another breast cancer in the future, a completely new one versus the normal population. So if you're 50 and your lifetime risk of developing breast cancer, you've never had a breast cancer, is at that age, let's call it 6 or 7%. If you've had DCIS and you're 50, then your lifetime risk of getting another breast after having the DCIS taken out and keeping your breast is probably 10%. So it is a risk factor for future cancers. So the way to think about it, if you have DCIS and only DCIS, you're going to do fine, but we have to treat it, and that's what I'm going to cover next. So what are your surgical options with DCIS? Well, the primary treatment for DCIS is breast cancer surgery. And the vast majority of patients are so well treated with a lumpectomy, a breast-conserving surgery, but usually followed by radiation therapy to that breast. It's not always needed, but most of the time it is. So let me kind of give you the idea behind a lumpectomy. A lumpectomy surgery, and you can take our course, our video course on lumpectomy versus mastectomy at the Breast Cancer School for patients to learn more detail. But in general, if an area of the breast has DCIS and it's small enough, then we can remove that area of DCIS with a surgery with a good margin of normal breast tissue around it, kind of implying we got it all. And close things up, keep the breast, and not do a mastectomy. But there's always a tiny chance that there might be a few cancer cells or DCIS cells left behind, even though we tell you we got around it well, that might grow in the future as a local recurrence, cancer growing back in that area. So radiation dramatically reduces the chance of something growing back in that breast by killing some of those cancer cells that may or may not be there, and we just don't know until something comes back. So a lumpectomy, generally followed by radiation therapy, is just as effective as a mastectomy for curing breast cancer in general, early stage breast cancer, invasive breast cancer, and also for DCIS. There's some situations, which I'll cover shortly, that you can avoid radiation for DCIS. But if you have multiple areas of DCIS in the breast, an area of DCIS on one side, another area of DCIS on the other side, or a large area of DCIS that's too large to remove with a lumpectomy, you may require a mastectomy.